Okay, we are back with our 2:30 public hearing, and this is a public hearing on the 2024 through 2025 biennium budget, health and human services, public health and social services, and emergency services. It is 2:36 PM, and I'll pass it right back to Nicole.
Thank you, Chair. So we're here to speak about health and human services for the 2024-2025 biennium public hearings. First department I'm going to speak to is public health and social services. The next will be emergency services. After speaking to both of those departments, there are budgets for 24 and 25. I'll hand it back over to the commissioners and to the chair of the board. So public health and social services provides public health and environmental health, including disease control and prevention, food and water safety, treatment for mental health and chemical dependency disorders, services for developmental disability youth, and adults, and affordable housing and services for veterans. Some of the policy level changes located within the 24-25 biennium include the Healthy Lakes Comprehensive Study, also community wellness education and outreach positions, removing the end date for that, as well as environmental health positions, removing the end date, foundational public health services allocations, Board of Health clerk of the board, vital services procurement and grant specialist, as well as nurse and family partnership positions, new FTE medical social worker, a new FTE also in community health worker, as well as opioid settlement outreach. And if we go to the next slide, there's also a list that I'll speak to. Vital services leadership and divisional support capacity, as well as developmental disability community project grants. So there are a list of policy level change requests for public health and social services. I did not list all of them, but they are located within the sheets here. So the total budget for 2024 is $76.5 million, and in 2025, $76.9 million. And that is for public health and social services. The next department is emergency services. Emergency services supports Medic One and emergency management. The policy level requests located in the 24-25 biennium include Medic One equipment, as well as Medic One's 8th unit and staffing of it, emergency services director, the salary reallocation, emergency management, Homeland Security Region 3 incident response team, as well as grant placeholders for the federal fiscal year 2023 Homeland Security and 2024 Emergency Management Preparedness Grant, and general fund reductions. The 2024 budget includes a total of $25.7 million, and 2025, $26.3 million. So those are the two departments for this opening this part of the public hearing. I have no other comments, Chair.
Thank you. Questions for Nicole?
No questions at this time from me.
Okay.
Thank you.
So we'll go ahead and open it up for public hearing. Okay, there is no one signed up. Is there anyone here who would like to provide public testimony? Okay, so we'll close the public hearing. Commissioners, any additional discussion for public health?
Where is the 8th medic unit going, or is that to be determined? And based on what is that determination made?
Absolutely. At this point in time, the 8th medic unit's location hasn't been determined. We're currently going through data analysis on 2019, 2020, 21, 22 data for ALS responses and looking at where it would best support Thurston County residents for its response. Further conversations are to be had at Operations and EMS Council. Operations Committee, which is a subcommittee of EMS Council, and EMS Council.
Thank you.
Absolutely.
I guess for public health, my question would be, the positions that we approved, they're all meant to start, even the TST ones, they're going to be starting on January 1st of next year?
A good majority of them are, but not all of them. There's phasing for some of them. So we have positions that would start mid-year, and some even that would start in 2025 based on the needs and the funding availability. But the majority of them would start January 1st, yeah.
Can you expand, or I guess I can ask these questions tomorrow. How would the phasing work with the fundamental, like with?
So anything that's FPHS starts January 1st. It's for the ones that we had other funding like TST or Medicaid, other fund sources, those are the ones we have flexibility to start dates. For FPHS, there's no flexibility. We're starting those January 1st. Does that make sense? Since the funding ends in June, we're trying to get that ramped up
Yeah.
as soon as possible.
I get that. I was gonna ask about the hiring, but then you've just mentioned something that has kind of piqued my interest, and in terms of the positions for TST and the Medicaid ones, which were mostly for NFP, you said they would be phased in, and I'm wondering kind of why that is and how did we land there from
I'm
the
basing it, and I could be
deliberations?
wrong, I was basing on what I thought the committee was recommending. The TST advisory committee was recommending some phasing of the timing for that. I could be wrong about that. I'm looking at budget staff on that front.
Yes, so there are some positions in TST that were phased in. They're supposed to start halfway through the year in 2024. We could have a list of those, of what positions are supposed to be phased in.
Could we, because I don't remember, while we were making those decisions, I don't remember us phasing them in, so maybe just a review of, and some clarification on those.
Yeah, but the bulk, like 90% of our positions we're looking at January.
Okay, you took me down another avenue I was not expecting to go, but, so, okay, I'll ask more about that. But I was, again, going to ask about the HR position that we approved just because of the amount of positions, the level of positions that you are. And I'm wondering, you know, when you first came in front of the board, there were some questions, and I'm just wondering if you kind of figured out which bucket that would fit in.
Yeah, I think if this is the position I'm thinking about, there's an HR position that Public Works and Public Health are kind of co-sponsoring or co-supporting. So we're actually working with Public Works on an MOU with HR to lay out what that would look like. So we've got some drafts floating around between the two departments that we're hoping to get out soon. So yeah, we've been putting some energy into thinking how that would work, and we're appreciative of the county's support for what we're trying to do in the future. So yeah.
Okay, thank you. Okay, so it's 2:43. There's no additional questions. We will be back at 3:30. Thank you.